Allergy. Allergy is a reaction of the body's immune system to substances that are normally safe for most people. In this case, the immune system perceives these substances, allergens, as dangerous and mobilizes defense mechanisms to fight them. This leads to a variety of symptoms. Here are some of the most common types of allergies. Allergic rhinitis, characterized by runny nose, itchy eyes, sneezing and stuffy nose. Atopic dermatitis or eczema appears as itching, redness and inflammation of the skin. Allergic contact dermatitis occurs when in contact with certain substances, causing itching, rashes and redness of the skin. Food allergies can cause symptoms such as itching around the mouth, swelling of the throat, nausea, vomiting, diarrhea and urticaria. Allergic asthma, characterized by narrow bronchi, causing episodes of shortness of breath, frequent coughing and difficulty breathing. There are many types of allergies, but here is the strangest of them: allergies, known as water hives, found in 1 in 23 million people worldwide. These people are allergic to non-distilled water, and getting in the rain is suicide for them, and they rarely wash, because even small water procedures cause fever and rashes. Let's look at these types of common allergies one by one. Number 4. Allergic contact dermatitis. This is a type of allergic skin reaction that occurs when you come in contact with certain substances, allergens. This type of dermatitis develops only in people who have an individual allergic reaction to a specific allergen. Allergens that can cause contact dermatitis can be varied and include metals, such as nickel, often present in jewelry, cobalt and chromium, chemicals, including dyes, preservatives, drugs, and industrial chemicals, plants, such as poison ivy, sage, or poison tree. Symptoms of allergic contact dermatitis may include itching, redness and swelling of the skin at the site of contact with the allergen, the appearance of blisters, rashes or dry skin, swelling, and an uncomfortable burning sensation. Cracking and discharge of fluid from the affected area may occur. It is important to avoid contact with known allergens to prevent allergic contact dermatitis from developing. If contact does occur, the following measures are recommended. Immediately rinse the area of skin that has been in contact with the allergen with non-hot water and mild soap. This will help remove the allergen from the skin surface. After rinsing, avoid repeated contact with the allergen. Wear protective gloves or other protective equipment when handling chemicals. Avoid plants that cause allergies. Apply a cold compress to the affected area to relieve swelling and soothe the skin. Number 3. Food allergies. A food allergy is an immunological reaction of the body to certain foods, usually protein products. It occurs when the immune system misperceives certain proteins in food. That is, it perceives them as dangerous substances and triggers an immune response. Here are the top common foods that cause food allergies: milk and dairy products, especially cow's milk, eggs, wheat and other grains that contain gluten, nuts, including peanuts, almonds, hazelnuts and walnuts, fish and seafood. Symptoms of food allergies can vary depending on the person and the severity of the reaction. They may include urticaria, itching and redness of the skin, swelling of the lips, tongue or throat, abdominal pain, diarrhea or vomiting, shortness of breath, anaphylactic shock, which is a severe and potentially life-threatening reaction involving general itching, swelling of the throat, difficulty breathing, a drop in blood pressure, and loss of consciousness. Treatment of food allergies consists of completely eliminating from the diet those foods that cause an allergic reaction. In the case of anaphylactic shock, the symptoms require immediate medical attention, and epinephrine and other medications may be needed to relieve the symptoms. It is also important to be vigilant when reading food labels to avoid accidentally consuming allergens. If you or your child has food allergies, it is recommended that you consult with your doctor. to develop an appropriate meal plan, and to learn more about preventing and managing food allergies. Number 2. Atopic dermatitis or eczema. Atopic dermatitis, also known as eczema, is a chronic inflammatory skin condition characterized by dryness, itching, redness, and rashes. This condition is usually associated with genetic predisposition and allergic reactions. Here are the symptoms of atopic dermatitis. Skin becomes dry, flaky, and prone to irritation. Frequent and intense itching that can lead to scratching and skin damage. The skin becomes red, especially in the bending areas, such as elbows or knees, on the neck, face, and hands. Blisters, rashes, crusts, or moist sores may occur. Some areas of the skin may be swollen and inflamed. People with atopic dermatitis may have increased skin reactivity to various allergens, such as pollen, dust, mold, animal hair, certain foods, and chemicals. Treatment of atopic dermatitis usually involves a combination of the following approaches: moisturizing the skin. Regular use of moisturizers, such as creams and ointments, helps retain moisture in the skin and prevent dryness. Dry skin is a major cause of eczema, therefore, a basic element of prevention is gentle daily skincare. A daily shower or bath is recommended, but do not stay in the water longer than 10 minutes. Also, avoid hot water, as it dries the skin. Wash only your armpits and intimate areas with soap. You should not soap your whole body, as this will help wash away the natural oils in your skin. After showering, gently pat skin dry with a towel, without rubbing, while your skin is still wet. Apply a powerful moisturizer to your entire body. Avoiding allergens and irritants. Try to avoid contact with known allergens and irritants that may cause exacerbation of symptoms. This may include avoiding synthetic clothing, harsh chemicals, pollen, dust. Avoiding overheating and overcooling. Extreme temperatures can exacerbate symptoms, so it is important to maintain a comfortable environment. It is important to see a dermatologist or allergist to diagnose and develop an individualized treatment plan for atopic dermatitis. In some cases, if the symptoms are severe and unmanageable, the doctor may prescribe systemic anti-inflammatory medications or immunomodulators to control condition. Number 1. Allergic rhinitis. Allergic rhinitis is an allergic inflammatory disease of the nose caused by an allergic reaction to various allergens in the environment, such as pollen, dust, pollen mites, mold, animal hair, and other substances. Symptoms of allergic rhinitis may include a feeling of stuffy nose, frequent and repeated attacks of sneezing, discharge of large amounts of clear mucus from the nose, feeling of itching in the nose, often causing the need to scratch or rub the nose, itchy, red eyes with lacrimation, runny nose and cough may also accompany allergic rhinitis. Prevention and treatment of allergic rhinitis include the following approaches. Try to avoid contact with allergens that cause symptoms. For example, if you are sensitive to certain pollens, watch the pollen forecast and try to stay indoors during peak pollen concentrations. Using air cleaning products, using humidifiers and air purifiers with HEPA-type filters, also using vacuum cleaners with such a filter, can help reduce the amount of allergens in the air. Regular dusting of the home, removing mold and pollen from the environment, and avoiding pets are also important. Using antihistamines. They can reduce symptoms of allergic rhinitis, such as itching, runny nose, and sneezing. Medications may be available over the counter or with a prescription. Depending on the intensity of the symptoms, use of nasal sprays or drops. Nasal sprays or drops can reduce inflammation in the nasal passages and reduce symptoms. Immunotherapy. When symptoms are difficult to control or significantly affect quality of life, doctor may recommend allergen-specific immunotherapy. This is a procedure in which allergens are injected into the patient's body to gradually adapt the immune system, reducing the response to allergens. Chronic rhinitis may benefit from such natural treatment methods. Use of decoctions of twigs of black and red currants, leaves of marshmallow and eucalyptus. Nasal lavage with calendula infusion mixed with chamomile flowers. Nasal compresses with grated raw onions. Ingestion of a mixture of grated lemon peel and honey. Installation of eucalyptus, peach, rose, sea buckthorn, and olive oils in your nostrils. Maintaining a healthy lifestyle. It is important to lead a healthy lifestyle, including a healthy diet. Avoiding smoking and regular physical activity. Often regular physical activity leads to normalization of the work of the vasoregulatory nerve centers, and the manifestations of rhinitis recede. For some people with allergic rhinitis, symptoms may improve temporarily when they are at sea. The sea climate can be more humid, which can help moisten the nasal passages and reduce the dryness of the nasal mucosa, and this can lead to a reduction in the symptoms of allergic rhinitis. For more information or advice, you can contact us on the WhatsApp number you see on your screens. Subscribe to our YouTube page and share your comments. Specify your questions and topics of interest in the comments. You can subscribe to our Telegram, Instagram and Facebook pages. Links can be found in the description below this video. Thanks for watching. Stay healthy.